Providing healing, promoting hope. That is the theme of this year's Celebrating Women event, inspired by the National Women's History theme of the same. My name is Sandy Pensano-Conway, and I am the Interim Director of the School of Communication Studies and the Interim Coordinator of the Women, Gender, and Sexuality Studies program, both at SIU. I'm also a volunteer and board member for the Rainbow Cafe LGBTQ Center based here in Carbondale. And on behalf of our organizers and sponsors, welcome. Thank you so much for joining us tonight as we pause in our busy schedules. Women tend to have very busy schedules. As we pause to celebrate, honor, and uplift all the ways that women, broadly defined, provide healing and promote hope. This year has felt unprecedented, as we are wont to say these days. As we slowly and cautiously emerge from the pandemic, we of course think of our caregivers and frontline workers who have provided ceaseless healing to us. When we consider the sacrifices of our sisters across the globe, we are also filled with an enormous sense of hope as we imagine what our world will look like in the years to come. Our speakers tonight and the women we will honor throughout the evening have exemplified what it means to heal and hope. It's difficult not to think of current events and moments like this. On the world stage, we watch as Ukraine struggles through a terrible war, and we see images of women doing important work of healing and hoping for Ukraine all across the world. In pop culture, we witness moments like Ariana DeBose, the first openly queer woman of color to win an Academy Award, promoting hope to others like her that they can be true to who they are. In the sports arena, we marvel at the dignity and grace of Leah Thomas, the skilled and well-decorated swimmer who, just this month, won an NCAA Division I national championship and also happens to be transgender. She has found herself at the center of an often nasty and dehumanizing debate regarding transgender athletes in sports. But along with the bitter and infuriating comments, has also emerged fierce healing and hopeful messages of support and belonging. In the political arena, we may be on the verge of seeing the first Black woman Supreme Court judge with the potential confirmation of Judge Ketanji Brown Jackson. And in the medical field, women of all ages are making important breakthroughs. For example, 15-year-old Anika Chabrolu, along with her mentor, identified a lead molecule that would potentially inhibit the novel coronavirus and subsequently received the 2021 3M Young Scientist Challenge for her discovery. While these may be public eye spotlight examples, they all began somewhere at home in their local communities. That is the spirit of Celebrate Women, to acknowledge the important contributions that women make, not just globally, but locally as well. And we've been doing this for almost 20 years, even more in other forms. And so I ask you in this moment to imagine who you might identify as the women who have provided you with healing and promoted hope within you. Perhaps it's a parent or sibling. Maybe you've been healed by the gentle words or actions of a doctor or a teacher. You may have gone to City Hall here in Carbondale with an issue to raise and been met with an unexpected listening ear. What is certain, I'm sure, is that each of us have had at least one woman come to mind. And so here's to strong women. May we know them, may we be them, may we raise them. I'd like to now turn the screen over to Dr. Bobby Knapp, who will introduce our honorary chair for the evening.
Thank you, Sandy. It's my pleasure to introduce this year's honorary chair, Dr. Julian Wallace, Director of School of Health or Human Sciences. Dr. Wallace has been at SIU for nearly 2 decades now. She originally came to the university as an assistant professor, exercise science in the Department of Kinesiology. Since that time, she has been a part of many different leadership opportunities, taking on program directorship of the exercise science program, chairing 2 different programs at one time, taking on the opportunity to be the interim associate dean of the graduate school, and in her most recent position as the director of the School of Human Sciences. She has, in addition, done a number of work in volunteer services outside of the university itself, working with a volleyball program within the Midwest or the Southern Illinois region, and also working with the Midwestern American College of Sports Science. In that position, she has worked as president, also been on the board of directors, and in 2019 received the Founders Award from that particular organization. Please join me in welcoming our honorary chair, Dr. Juliane Wallace.
Good evening, everyone. Thank you, Dr. Knapp, and thank you to the 25th Annual Celebrate Women's Organizing Committee for inviting me to serve as the honorary chair this year. It is truly a privilege. I have to admit that when Bobby first extended the invitation, my initial thought was, why are they asking me? It is frustrating to me that even as a mature, I will not admit to being old yet, but mature and fairly accomplished and confident woman, I still have to retrain my brain to accept that I have something to contribute. I really appreciate the opportunity to add my voice to celebrate those women who have paved our way. Women like Madeleine Albright, who recently passed, Kamala Harris as the first female vice president of the United States, and as Sandy mentioned, Ketanji Brown Jackson, who is likely to be confirmed as the first African-American female Supreme Court justice, Dr. Ngozi Ezike, who led Illinois through the pandemic, and many, many, many others. The theme of this year's event and focus of the month, Women as Healers, Providing Healing, Promoting Hope, is the perfect theme for this time in history. The world has endured a pandemic for over 2 years, a pandemic that shut down schools and businesses and completely turned our lives upside down. From healthcare to home care and schooling, to restaurants and grocery stores, women workers, low-paid workers, and women of color were on the front lines of the COVID-19 pandemic. Gender, racial, and economic inequities that already existed in the United States were magnified as we navigated the health and subsequent economic crisis brought on by the pandemic. Over 80% of healthcare workers and 85% of people who provide social assistance are women. These women-dominated occupations were among the most vulnerable to getting sick and spreading it to others. They were also the ones who had to bear the brunt of schools closing and make decisions about whether to go to work to support their family or stay home to ensure that their children didn't fall behind in their education, a decision we should never have to make. We are experiencing the consequences of the pandemic and our responses to it in almost every sector of society, from healthcare to education to economy to everything. Likely, many consequences will not be identified for some years. We need to provide healing, physical, mental, and emotional healing. According to a report released by the World Health Organization earlier this month, the COVID-19 pandemic triggered a 25% increase in the prevalence of anxiety and depression worldwide. The report went on to indicate that young people and women have been the worst hit. Despite this alarming increase in mental health concerns, governments worldwide spent on average just over 2% of their healthcare budgets on mental health. I firmly believe that we need more women in leadership roles to promote other women and to influence the funding decisions as well as other decisions. In addition to providing healing, we need to promote hope. I don't know about you, but I'm almost afraid to say that we are coming out of this pandemic for fear that another variant will cause an additional outbreak and subsequent shutdown. I believed I was handling the stressors of the pandemic for the most part, but emotions are running close to the surface for me as well. I was almost brought to tears this morning when I ran into a student that I had become fairly close to in class during the spring of 2021. I did not recognize her at first because this was the first time that I had seen her without a mask on. She came up, gave me a big hug, and told me how grateful she was that I had held class in person last year because it kept her from feeling so isolated and gave her hope. What a difference seeing her smile made. We do have hope and a responsibility to promote it. Who better to do that than the women who work in healthcare, education, social work, public health, or any other of the vocations that we all represent? Like many who are struggling to determine what the new normal will be and how we can come out on the other side stronger, I believe we as members of higher education are uniquely positioned to investigate the consequences and lead in the development of curricula and training to assist our students in providing healing and promoting hope. In National Youth Poet Laureate Amanda Gorman's words, "The new dawn blooms as we free it, for there is always light, if only we're brave enough to see it, if only we're brave enough to be it." Thank you very much for joining us this evening.
Thank you so much for your remarks, Dr. Wallace, and for highlighting our theme so very well and bringing us up to the minute. I'd like to thank everyone who came together to accomplish the task of holding this event virtually. It was a challenge for sure. The last Celebrate Women was held in 2020 as a live event, I think on March 5th, just before the pandemic shut everything down. We had to miss 2021, but we are back this year in a different format, but with the same goals: to celebrate the accomplishments of women and to recognize scholarship winners. Great thanks to the co-host for this event. The Office of the Associate Chancellor for Diversity is a longtime supporter, and Carol Jackson of that office was helpful in the initial planning this year. The School of Human Sciences, and again, we are honored to have Dr. Wallace participate in the program, and so appreciate her remarks. The Carbondale Public Library, without whom we would not be doing this virtual event. Jennifer Roberts, our behind-the-scenes coordinator of everything, that might not be her exact title, keeps us all in line and on track with aplomb. Women, Gender, and Sexuality Studies, long a participant in and sponsor of Celebrate Women. And Sandy Pensano-Conway, the director, was involved in the planning of this event. The SIU Women's Club. For the past several years, they have participated in Celebrate Women, recognizing their scholarship winners at the event, and we're delighted to have them with us this evening. And AAUW Carbondale Branch, in it from the beginning. Participating members this evening, besides myself, our president, Ella Lacey, newsletter editor, and Facebook page admin, Jennifer Robertson. And I don't think I left anyone out. I hope not. If I did, I'll be back. And I'd like to thank our audience very much for attending. Now, for many years, it's been our practice in this Celebrate Women event to invite back a previous scholarship winner to express her appreciation for the program. This evening, these remarks will be made by Slovenia Roberts, the 2021 AAUW Joyce Kelly Scholarship recipient and a master's candidate in playwriting.
Hi, my name is Slovenia Roberts. I'm a graduate student in the School of Theater and Dance here at SIU. I'll be graduating this May with an MFA in playwriting. I want to extend my gratitude to AAUW for awarding me the Joyce Kelly Scholarship in 2021. I really appreciate the support that the scholarship gave me to develop as a playwright, a student, as well as an instructor in the School of Theater and Dance. So thank you so much for your support of me and my work, and wishing you all the best at your Celebrate Women event.
It is such a pleasure now to introduce our featured speaker this evening, Laurie Ryznyk, co-founder of the Physician Assistant Program at SIU School of Medicine. As such, she helped to develop the curriculum, clinical sites, and the evaluation methods used through all the phases of the program. She is presently a professor and associate director of the PA program. She leads workshops in problem-based learning concepts and methodology in medical education. Her other teaching interests include infectious disease, women's health, internal medicine, clinical reasoning, and diversity in medicine. She has also been active in teaching about human trafficking to schools, healthcare, and service providers, and she serves on the Central Illinois Human Trafficking Task Force. She has been teaching physician assistant students and medical students about human trafficking for a number of years, and she has presented about human trafficking victims and medical evaluation at state and national conferences. She is a distinguished fellow of the American Academy of Physician Assistants. She was selected by the Illinois Academy of Physician Assistants as their Region 6 Outstanding Physician Assistant in 2020. That year, she also received the Southern Illinois chapter of the UN Association's Human Rights Day Award for her work on human trafficking. Certainly, given the theme for Women's History Month and for this event, Women as Healers, Providing Healing, Promoting Hope, Laurie Ryznyk is an outstanding example, and I'm very pleased to introduce her.
Thank you so much for giving me this opportunity to pay tribute to women healthcare workers, healers, and caregivers who have provided healing throughout the pandemic and are sustaining hope for the future. It has been a grueling 2 years. I have lost 14 individuals I know, including patients, a friend, and an aunt due to COVID. Throughout this time, women have provided more than healing and hope. They have had to be all things for all people within their family units and their work sites, in hospitals, ICU, emergency departments, clinics, long-term care facilities, in frontline testing, and in education and administrative positions. Women have provided incalculable gifts to so many, sometimes with great sacrifice. These are counselors, educators, social workers, respiratory therapists, doctors, nurses, PAs, dietitians, lab techs, receptionists, faith leaders, dentists, hygienists, physical therapists and assistants, public health workers, military employees, coaches, and school teachers, to name a few. During the pandemic, innovations were necessary. Women leaders rose to the occasion. Their ability to learn, collaborate, and problem solve provided solutions for their teams in their care of patients. The most recent Women in the Workplace report, published by the consulting company of McKinsey & Company, found that women leaders have done more than their male counterparts in similar positions to support the workforce. This research also shows that the burnout gap between men and women has almost doubled since last year's report. Women were on the front lines, providing 24/7 care to those who were most seriously ill. The toll has been unimaginable. They have without sufficient they were without sufficient personal protective equipment, risking their own health, along with the health of their families. They had to choose whether they would isolate from family members or take the risk of infecting those they love. This is a huge weight and responsibility, and the cognitive dissonance of these decisions affected their mental, physical, and emotional health. They faced the challenges of treating COVID patients and communicating with families in ways never seen before. They faced the challenge of treating an infectious disease unknown really to the world. COVID acted in ways that were unpredictable. It affected almost every system of the body and was extremely complex. Patients presented in a myriad of ways and could crash quickly and unpredictably. This caused stress in those who were used to curing patients, and they faced the biggest challenge of their medical careers. In the throes of the pandemic, there was no evidence-based medicine information available, and knowledge was acquired by trial and error and death and autopsy. There has been nothing like this in our lifetime, and explaining this to the general public was difficult, frustrating, and challenging. Next, moral injury occurred as the medical field became the brunt of frustration and attacks from the public. Misinformation was rampant. Political agendas took precedent over public health. Medical professionals and leadership and on the front lines were attacked. They were attacked verbally and physically. Social media provided unfettered platforms for anyone to promote hate, non-scientific treatments, and division throughout our country. Women faced an increase in domestic violence, and those in healthcare have seen alarming increases in workplace violence. According to a study published in the Journal of Pulmonology, female frontline workers face higher rates of depression, anxiety, and suicide. 1 in 4 women report becoming unemployed, and attributed this to lack of childcare. Only 25% of women say that the extra work performed during the pandemic has been reflected in their performance review, a promotion, or a raise. Burnout rates are soaring, and for women at the intersection, women of color, for example, or LGBTQ+ women, is higher. As we look at intersectionality, barriers are all around. We see that Asian women account for 1 in 5 entry-level roles among women, but only 1 in 50 in executive level management. If you are a Latinx or Black woman or a woman with disabilities, at each of these intersections, the likelihood of being promoted is met with challenges all along their journey. We also know that microaggressions and the experience of being an only in leadership are also quite acute. The McKinsey report also finds men disproportionately get access to first-level managerial promotions, which affects women's careers all along their journey. This is why the theme of Women's History Month and this event provides a bridge of healing to all these women who have made innumerable sacrifices and have suffered unspoken pain. We thank you, we honor you, and we support transition through hope for the future. The AAUW states on their website, women have long advocated for compassionate treatments and new directions in public health and in women's mental and physical health. Women have also historically led the way in mending divisions, healing wounds, and finding peaceful solutions. I believe the season we are in right now could be called the Great Reflection. I believe that the leaders at SIU are serious in their desire to make change, to honor women for their intellect, abilities, and skills, and advocate change in the systems from the status quo. This is a time of reflection and opportunity, a time to make paradigm shifts. These changes must support women in diversity, equity, and inclusion in education and all workforce arenas. It must include those in healthcare and for those who are caregivers. This is an opportunity to shatter old ways and provide new solutions. This is a time to support employment through childcare provision, flexible scheduling, respite care, and emergency care for elder or sick family members. Dr. Sheila Caldwell, the inaugural Vice President for ADEI and Chief Diversity Officer for the SIU system, has called for a shift in our belief system that change will take a long time. On a recent webcast, she called for formative solutions that must be developed quickly with no excuses, such as this will take decades. Allyship is also important. While close to 80% of managers in the United States will say, I'm an ally, the practical actions of offering an opportunity for a woman, especially women of color, such as bringing them into the circle they weren't in before, actually asking them how they are doing and supporting them, drops off then to the low teens. Groups such as SIU School of Medicine's He for She initiative is dedicated to men and people of all genders, supporting women in medicine and science in the mission of eliminating the gender equity gap. Models such as these can contribute to the solutions in all systems and at SIU in particular. Continued work to advance careers and leadership development activities will give women a voice in healthcare systems as we rethink delivery of care, policies, hiring practices, and create environments that support the recruitment and retention of women. We know that the AAUW has supported many efforts for women throughout its history. There is hope. Hope is anticipation for the better. Hope sees opportunities for change. We all have our own original imprint to make, our calling, our purpose. Native people groups call this original medicine. I thought this was very interesting. Interestingly, cultural anthropologist Angeles Arian notes that many Indigenous people groups do not have the concept of comparison among people because they believe each of us is different. We are all original medicine. As I think of the people who have influenced my life and the lives of many others, I think of hope. I encourage you to think of those women who have made an impact on your life, especially those in healthcare. I'd like to share a few of those who have made a difference in my life, if that would be okay. I think of my friend and colleague, Patricia McKnight, the survivor of family facilitated sex trafficking from ages 11 to 17 in a small town near here. She now trains medical personnel, law enforcement, teachers, and social service agencies in recognizing and supporting children and adults who are victims of human trafficking. I think of Dr. Ella Lacey, who has dedicated and educated and cared for countless people around the world and has served as a mentor for so many women and guided many organizations with grace, intelligence, and strength. I think of Dr. Marcia Ryan, MD, JD, who has provided surgical training to multiple students and residents, as well as practice management support. She has developed and supported initiatives in legal and medical education, end-of-life issues, and has supported the university through leadership and program funding. I think of Dr. Marielda Rockwell, my pediatrician in the 1950s, who was the only woman in her medical class. She showed me that women can be medical providers, even though male school counselors told me the medical career path was only for men. I think of Dr. Vidya Prakash, who is the chief medical officer and an infectious disease specialist in Springfield, who founded and directs the SIU chapter of the Alliance of Women in Medicine and Science, called AWIMS, and has spearheaded hundreds of workshops, forums, and roundtables focusing on women's issues in medicine, as well as professional development opportunities. She serves in leadership roles on many committees at the state and national level. She is chair of the Illinois Department of Public Health's Diversity in Healthcare Task Force. I think of Dr. Penny Tippie, who blazed trails at SIU Medicine as the program director for the Family Medicine Residency Program in Carbondale, as well as a clinician who provided care to a large panel of patients. She established multiple clinic sites and school-based health centers in rural towns in this region and forged the way for the SIU PA program. I think of Dr. Christine Todd in the Department of Medical Humanities, Dr. Sharon Hull, who directed the first-year medical student program at Carbondale, Dr. Martha Ellett, professor of physiology, who served as assistant dean for curricular affairs at the School of Medicine, and later as coordinator of the university Women's Professional Advancement Program. I think of Dr. Catherine Waldyke, who has provided education to providers and care for SIU LGBTQ patients. I think of PA Dr. Katie Scott, who has provided health care to patients in rural Southern Illinois for 28 years. I think of Dr. Barbara Brown, who forged the way in political science education, worldwide outreach, and legislative efforts at the state and national level, who is also my dear friend. I think of Dr. Caldwell, who reinforces that we must understand the urgency that this shift needs to happen. I think of St. Louis-born Dr. Maya Angelou and her intellect and wisdom, and the ability she had with words to cut deep into the important issues affecting the past, present, and future. I think of Haley Arsenau, who was the first PA in space. She was the first physician assistant, chief medical officer. So she was the medical officer on that trip. She's the youngest American, first pediatric cancer survivor, and the first person with prosthetic body parts to visit space. She works in inpatient oncology at St. Jude's Children's Research Hospital, where she was once treated as a child. I think of our graduates all over the United States, one who is attending here tonight, who are serving on the front lines as providers of medical care during this pandemic, and one who lost their life. I think of the SIU PA program student AAUW scholarship winners. One is working in dermatology at Howard University in Washington, DC, and was awarded the position of ambassador for the National Commission on Certification of Physician Assistants last year. She was also responsible for bringing a seminar to SIU called First in the Family, which was attended by Black and Brown students across the nation. She developed a teaching module on dermatology and Black and Brown skin for our students at SIU. I think of another scholarship recipient who is now working at a clinic in Central Illinois and provides care to inmates at a county jail. She works with the FBI in providing assistance through language interpretation and support in the investigation of human trafficking cases among Asian women. These graduates both currently serve on the PA Program ADEI Council. Today and in the future, we must call on the enthusiasm, vision, and creativity of youth and call on the wisdom and experience of our elders. We honor our healers and caregivers tonight. I encourage you to thank yours. It will be greatly appreciated. Members of the Carbondale branch of AAUW, your support has made the difference in so many lives. The ripple effect transcends time, and your advocacy scholarships, legislative efforts, community outreach, and support to educators have clearly made a difference. I look forward to seeing the future of this year's scholarship winners and how they will change people's lives. Thank you, SIU chapter of AAUW, from all of us who have been supported through your efforts, dedication, and time.
Wow, thank you so much, Laurie. That was indeed an enlightening and inspirational presentation. Again, thank you. Hello, everyone. I am Ella Lacey in my role as president of the Carbondale Branch of AAUW. I am happy to support this 25th Celebrate Women event by introducing the scholarship portion of Celebrate Women. I want to carry out my role by first reminding us all why we have needed and continue to need a celebration of women's scholarship. In March, during Women's History Month, it is a most fitting time to bring focus to women's scholarship, to emphasize the academic engagement and academic achievement of women students. It has long been known that female students are often leaders in learning and in teaching others. History has shown that rewards and awards were often given, but seldom given to women. Women's achievements were often cast aside, and women still struggle to overcome that history. When awards are designated specifically for women, we clearly see the high caliber of their work, and women are then pulled from the sidelines to the center of attention. That's what tonight's Celebrate Women and other similar events are about. You will see that in the selection of both AAUW, the American Association of University Women, and SIU Women's Club scholarship recipients. My second point is to inform you of the renaming of one of the AAUW scholarships. For some time, AAUW has had 3 categories of scholarships in the Carbondale branch. One, Leila Marvin Scholarship for a non-traditional student who entered and excelled at the community college level and is now ready to transition to SIU. The second one, the Joyce Kelly Scholarship for an exceptional SIU student. and the third one, a graduate scholarship. Tonight, we are excited to announce the renaming of our third category. That scholarship will henceforth be known as the Anna Morris Scholarship. The renaming is in honor of a 2021 departed member who was for many years an English teacher at Heron High School and AAUW Scholarship Chair. So tonight, we will proudly present the Anna Morris Scholarship for the first time. My third point, if you are in a position to help us increase our scholarship contributions, you are invited to consult the chat, where you will see messages from AAUW and SIU Women's Club giving you directions on how to contribute to either or to both. At this time, I thank you for indulging my comments, and I now ask Martha Eller to come forth with the AAUW presentations. Martha will be followed by Amelia Ketzel with the SIU Women's Club presentations. Martha.
Thank you, Ella. As Ella said, we have 3 categories of scholarships, and the first one I will announce is the Leila Marvin Undergraduate Scholarship. This is awarded to a female student at John A. Logan College completing an associate degree and enrolling in SIU in the fall semester. Excuse me. I'm trying to get myself out of this, but I don't see how I can do it. This year's recipient is Veronica Griswold. Veronica will receive her associate's degree in political science, and she has been accepted into the political science program at SIU. While working throughout college, most recently at the Logan IT Help Desk, she has maintained a high GPA and participated in many service and leadership activities. She has served as the John A. Logan Student Senate President, Political Science Club Secretary, and member of the College Council. She has also participated in many student-led service projects. Veronica is a non-traditional student in that she is a first-generation college student, married, and in a low-income household. While attending SIU, she plans to pursue hands-on experiences in the summer through internships. Her goal is to either become a legislative assistant or to pursue a career in law. She has always been interested in political science and will use knowledge gained from internships and other experience to decide on her future path. Congratulations to you, Veronica. Next, I would like to introduce can we get me out of the view and so we can just see the scholarship winners? I don't know if that's possible. Anyway, thank you. Maybe that helps. Anyway, this is the Joycee Kelly Memorial Scholarship, is awarded to a non-traditional female SIU student continuing or entering any field of graduate education or a program of professional education in law or medicine. This year's recipient is Amy Rogers, a second semester student in the social work master's program at SIU. She earned her associate's degree in psychology from John A. Logan in 2019, and she earned a BA in psychology with honors in 2021. She's a non-traditional student because she's a single mother of 2 children, and she decided to begin her higher education at age 33. At John A. Logan, she was on the student advisement board for TRIO, assisting students in financial need. She was awarded the Transfer Achievement Scholarship when she transferred to SIU. As an undergraduate, she worked as a research assistant, and she was consistently on the dean's list. In the spring of 2021, she was the SIU College of Health and Human Sciences honor recipient. In her senior year, she was invited to do a senior honors thesis, which earned the Gordon F. Pitts Research Award. After completing her master's in social work, she plans to pursue licensure as a clinical social worker and bring her educational experiences to the community that she loves and lives in. Congratulations to you, Amy. Our third scholarship winner this evening, the initial Anna Morris Graduate Scholarship. That is awarded to a female SIU student continuing or entering any field of graduate education or a program of professional education in law or medicine. This year's recipient is Victoria Hollinshead, a first-year student in the combined MD-MPH program in the SIU School of Medicine. This accelerated program will allow her to earn both her Doctor of Medicine and Master of Public Health degrees in 5 years. Victoria graduated with highest honors from the University of Illinois at Springfield in 2021 with a BS in biology and a minor in public health. She is currently a teaching assistant instructing sections of Public Health 101, Foundations of Public Health. She notes that educating undergraduates on the fundamental principles of public health and working to pique their interest in this field has been priceless. She is also part of SIU's patient hotspotting. The hotspotting team includes students from an array of field backgrounds working together to uplift the health and quality of a volunteer patient. She considers her decision to pursue both clinical medicine and population health as a crucial part of her lifestyle as a lifelong learner and health advocate, working to address health inequities and uplift vulnerable populations in Central and Southern Illinois. Congratulations to you, Victoria. And now I will turn it over to Amanda Ketzel with the SIU Women's Club Scholarships.
Hi, my name is Amelia Ketzel, and I am the president-elect of the SIU Women's Club. I'm here to present our scholarship winners this year, and the Women's Club typically awards two $2,000 scholarships, one for a traditional undergraduate student and one for a non-traditional undergraduate student. This year we were fortunate enough to be able to award 3 scholarships. So I'll tell you a little bit more about that when I get to that one. Our first scholarship winner for the traditional student scholarship is Caroline Schwallitz. I hope I'm saying her name right. This traditional student scholarship that she was awarded was named after Dorothy Morris. Carolyn is a junior at SIU Carbondale. She's double majoring in management and fashion design and merchandising, and she's specializing in entrepreneurship and design. She loves to hang out with her friends, reading anything creative, baking, learning about historical fashion, and being involved in student organizations and her local church. And her post-graduation goal is to start her own clothing brand. So we were really excited to award that scholarship to her. The next scholarship is our non-traditional student scholarship. And this one goes to Jewel Sanders. This particular scholarship is named after Joyce Guyon. Jewel is a sophomore at SIU Carbondale. She's in the nursing program. She's from Northern Illinois, and she was thrilled to be able to come to SIU for college. She loves Southern Illinois. She's in the Illinois Army National Guard. She works as a truck driver there, and she's also a team leader. And part of her guard service, she has 5 soldiers reporting to her that she's directly responsible for. And after she graduates from the nursing program from SIU, she would like to pursue her dream of being a labor and delivery nurse. So we were thrilled to give her this scholarship as well. Our third and last scholarship winner for this year is Darcy Trepo. As I said, we had we fundraise throughout the year for our scholarships, and if we're able to give additional money, we try to do that. And so this year we were able to give a third $2,000 scholarship award. And so we created just this year the Empowerment Award, and that was somewhat inspired by Darcy, because she just seemed like such a cool example of what we were trying to support. Darcy is a forestry major at SIU. She's going for her Bachelor of Science degree. She's completing this degree in just 3 short years. She loves to walk her dog on SIU's beautiful campus. She hikes in the Shawnee National Forest. She's involved with completing prescribed burns with the SIU fire dogs. That's our fire-related RSO at SIU. She leads her sorority, Alpha Gamma Delta. She loves nature in Southern Illinois, and she especially appreciates the geography down here because she came from a small farming community. And she's also been involved in some firefighting efforts in the Western United States, which we thought was extremely cool. So we were very excited to be able to give her this scholarship. And I would just mention one little plug. If anybody is able or willing to make a donation to the SIU Women's Club scholarships, we've been awarding scholarships for 80 plus years. I put the information in the chat. You can go see more information about our past scholarship recipients, as well as how to send in a donation if you're so inclined. So thank you for your time.
Mhm. Thank you, Amelia. And I just want to mention that also that if you look in the chat box, there's information about supporting either or both scholarships. In the past, this has been a fundraiser for women's scholarships. And of course, we can't do that virtually. So if anyone would like to contribute, please do so. But I want to thank all of the participants, every one of you, and all who attended. But I especially want to thank Bobby Knapp. She's listed as co-event coordinator. She was absolutely a spark plug that got the rest of us going and got us to where we are tonight. Thank you, Bobby. And thank all of you for joining us this evening, and good